Hey everyone, it's Dr. Mike from Pappas Chiropractic, and today we're going to be going over breathing. So a lot of us think, well, breathing, I breathe perfectly fine, as long as I don't have COPD or asthma or any other diseases or conditions, I breathe fine. Why do I need to focus on it? Well, a lot of us actually, one way or the other, we actually forget and don't learn how to breathe. So a great way to look at it, if you look at a baby and an infant and how they're breathing, they breathe with their stomach and their abdomen. They breathe with the diaphragm. So the diaphragm is a muscle that actually separates your lungs from your abdomen. And what that muscle does is when it contracts, it actually lengthens and increases the area for your lungs and allows you to take a deep breath in. So a lot of us go from stomach breathers to chest breathers as we get older. And what that does is the fact that when we lose the diaphragm, or diaphragmatic breathing is what it's called. If we lose that muscle, we lose that ability to do that on a regular basis, that muscle gets weak. Well, what happens is the fact that we have what's called intra-abdominal pressure, which means we have natural pressure in our spine, or in our abdomen, that pushes against our spine that helps stabilize it. So, a great example is the fact that if you're sitting there right now, you're watching this, you're breathing, you're not thinking anything about it, and you're probably breathing with your chest. Your chest rises and falls. So what we actually want is we want the abdomen and we want that diaphragm to push down, increase the intra-abdominal pressure that's on our spine, that's in our abdomen, to try and stabilize that spine and try and breathe correctly. So a great exercise to do if, maybe you realize after this video, wow, I do breathe from my chest a whole lot. Try this. So lay on your back. What you're going to do is you're going to just bend your knees. And what you want to do is you're just want to take your hands and put them in a nice little C shape and put them right on your sides. If they don't fit on your sides, then put your hands right behind your back. So what you want to do is when you breathe, you don't want your chest to rise. You want to keep your chest where it is. And you want to just breathe with your abdomen. So this takes a little bit of pressure and a little bit of practice. But you don't want to breathe just, having your stomach go far out. You actually want to imagine pushing down from here, from your mid-chest or mid-stomach, pushing down and then back up. So what that does is you should feel the pressure increasing to your hand, and it looks kind of like this. So it's So these are great things you can do to try and practice it. So again, we want to make sure we have that intra-abdominal pressure. So I don't know if you can see this, but when I'm breathing, I try and pull this as tight as possible. I don't want just this coming out. I want all this to move as well, to increase all of that intra-abdominal pressure. So this is definitely something that if you're worried about or you're thinking about, if you have low back pain, if you have sciatica and maybe it's been a chronic issue for a while, or maybe you did something and you can't think, I didn't get in a car accident, I didn't fall off a ladder or anything, and my back hurts. I don't understand what I did. I didn't turn wrong. Well, the intra-abdominal pressure can actually be a contributing factor. So there's other things that we usually do with patients, but that is one thing that we actually touch a lot with patients to try and help them. So if you have any questions, you can leave a question in the comment section below, or you can call our office, or the next time if you have an appointment, come in and ask Dr. Pappas or ask myself, hey, can you check my breathing? I want to make sure I'm doing this right. How can I make this better? So again, if you have any questions, please either contact Dr. Pappas or myself. I'll leave us your question in the comment section below. And until next time, everybody have a great day.